Well, I am Dr.K Gireesh, physician, neurophysician and neurosurgeon. To commemorate the World Cancer Day, which falls on 4th Feb 2023, I like in fact to tell various aspects of the prevention of cancer. The theme of the World Cancer is close the care gap. Now, this talk of mine is on behalf of the Lions Club of MADRAS Excellence, District 324K of Lions Clubs International, as well as on behalf of Padma Clinic and Nursing Home, 753 Punamali High Road, Chennai. Well, there are certain important tips to prevent cancer. Let us go by each one of them a little in detail. Now, if you just see the literature, there are several advices that have been given based on various research, but sometimes you find contradicting results do occur. However, there are certain lifestyle choices which in fact one can alter or change so that one can prevent cancer. Now let us see those particular lifestyles which we can actually change and then try to prevent cancer. One is smoking has been linked to many types of cancer, like the cancer of the lung, mouth, throat, cancer of the voice box, the pancreas, bladder, cervix, kidney, and so on. But not only smoking, even chewing tobacco can produce cancer of the mouth, throat, pancreas. So therefore, avoid smoking, avoid chewing tobacco. The other in your diet is eat plenty of fruits and vegetables. These are quite good. That is like whole grains, beans. Eat lighter and leaner by choosing fewer high-calorie foods. Limit the refined sugars and fat from the animal sources. Avoid drinking alcohol. That's the other aspect of preventing cancer. But even what you can in moderation, it has also been advised by WHO and others that you can drink alcohol in moderation. But however, studies have shown that alcohol can increase the various types of cancer, including cancer of the breast, colon, kidney, lung. So drinking, mind you, can increase the risk of cancer. The other one is limit eating processed meats like sausages and so on. And this news comes from a report from an International Agency for Research on Cancer and a cancer agency of the WHO. So eating plenty of fruits and vegetables is good. Avoid alcohol as much as possible. Limit the processed meats. Then there is a diet called a Mediterranean diet, which in fact contains of olive oil, mixed nuts, have reduced risk of breast cancer. The Mediterranean diet in fact focuses more so on fruits, vegetables, whole grains, legumes and nuts. People who follow the Mediterranean diet choose healthy fats such as olive oil over the butter. They eat fish instead of red meat. Another thing is maintaining your weight according to your age. That's a very, very important thing. Overweight again can increase the incidence of cancer. Physical activity is very important, especially isotonic activity like walking, running, jogging, swimming. These are very good exercises, and this can be done like every 1 hour in the morning and 1 hour in the evening. So physical activity or physical exercise is also very essential in fact to prevent cancer. The other one is exposure. Too much exposure to sun can in fact produce cancer, especially to the skin. So it is said that you avoid the sun too much of exposure between 10 a.m. and 4 p.m. or stay in the shade or cover your skin as much as possible with clothes. That's again a very important aspect. The other one is protect yourself from certain virus infections or get vaccinated against those. Number one is hepatitis B. Hepatitis B, those people who are prone to get hepatitis B are those people having sex with more than a partner. It's a sexually transmitted disease too. The other people are those who are using illicit drugs. And the other very important aspect is amongst healthcare workers, needle prick. If from a hepatitis B positive can in fact produce hepatitis B, they are prone to get cancer. Therefore, have the hepatitis B vaccine taken at 0, 1 and 6 months. 3 doses will have to be taken. And the other one is prevention against human papilloma virus. It's again a squamous cell carcinoma of the cancer of the cervix, and this can also be prevented by taking an HPV vaccine. So, practice safe sex. Limit the number of sexual partners and use a condom when a sex is being done. And this in fact prevents both HIV and HPV. People who have HIV, they also have a higher risk of getting cancer. Don't share the needles. Injecting drugs with needles can lead to HIV as well as hepatitis B and another virus infection called hepatitis C, which can also be prone to get cancer. Radiation exposure, that also, especially ionizing radiation exposure amongst healthcare workers, they must protect themselves with a lead apron or a thyroid guard and a gonad guard, which is again very important to prevent cancer. Next is reducing the exposure to outdoor and indoor air pollution is another very important method in fact to reduce cancer. Doing regular self-exams, that is again very important to prevent cancer. And the other very important is at least once a year do a screening for cancer, especially those people who are above the age of 50. These are some of the tips to prevent cancer. To summarize, to close the gap for prevention, to summarize: 1. Avoid smoking. 2. Avoid chewing tobacco. 3. Avoid drinking alcohol. 4. Avoid drinking alcohol. 4th is eat plenty of fruits and vegetables. 5. Avoid processed meats. 6. Maintain adequate weight for your age. 7. Do isotonic moderate exercise on a regular basis. 8. Avoid exposure to too much of sun. 9. Reduce the exposure to outdoor and indoor air pollution. 10. Get vaccinated against hepatitis B vaccine and HPV. 11 is minimize exposure to ionizing radiation in healthcare workers. 12. Practice safe sex. 13. Don't share the needles. And 14. Do regular self-exam. And 15. Have regular screening for cancer done at least once a year for those people who are beyond the age of 50. Well, let's unite to make the world aware to close the gap in cancer prevention. Thank you very much.